NCLEX-PN Review. Question 1. The practical nurse cares for a patient with hypokalemia and accelerated hypertension. The physician has listed the cause as hyperaldosteronism. Which of the following endocrine disorders causes increased aldosterone? Select all that apply. Option A, Cushing disease. Option B, Conn syndrome. Option C, Crohn disease. Option D, Addison disease. Option E, Hashimoto thyroiditis. The correct answers are options A and B, Cushing disease, Conn syndrome. Cushing disease and Conn syndrome both cause increased aldosterone. Cushing disease results from increased secretion of adrenocorticotropic hormone leading to elevated cortisol and aldosterone levels. Question 2. The nurse is assessing a client with pheochromocytoma. Which of the following would be an expected finding? Select all that apply. Option A, hyperglycemia. Option B, hypertension. Option C, headache. Option D, ataxia. Option E, bradycardia. The correct answers are options A and B and C, hyperglycemia, hypertension, headache. Pheochromocytoma is a tumor of the adrenal medulla that secretes catecholamines, leading to expected findings of severe headaches, hypertension, hyperglycemia, and tachycardia. Question 3. The licensed practical nurse is collecting data on a client who is pregnant. Which of the following findings would require follow-up? Option A, a third heart sound. Option B, absence of menstruation. Option C, burning with urination. Option D, dependent edema. The correct answer is option C, burning with urination. Burning with urination is an abnormal finding that may indicate cystitis and requires a prescribed urine analysis to rule out a urinary tract infection. Question 4. The nurse is evaluating a client for the development of a paralytic ileus. Which of the following factors increase the risk for this condition? Select all that apply. Option A, hypokalemia. Option B, infusion of fentanyl. Option C, early postoperative ambulation. Option D, high fiber diet. Option E, adequate oral hydration. The correct answers are options A and B, hypokalemia, infusion of fentanyl. Hypokalemia and the infusion of opioids such as fentanyl decrease gastrointestinal motility, significantly increasing the risk of a paralytic ileus. Question 5. The nurse is demonstrating the appropriate use of a car seat to a client. The nurse is demonstrating which level of prevention? Option A, primary prevention. Option B, secondary prevention. Option C, tertiary prevention. Option D, quaternary prevention. The correct answer is option A, primary prevention. Demonstrating car seat safety is a form of primary prevention, which focuses on health promotion and the prevention of illness or injury before it occurs. Question 6. The nurse is evaluating client laboratory results and notes that the potassium is 5.5 milliequivalents per liter. Which of the following electrocardiogram changes would be associated with hyperkalemia? Select all that apply. Option A, tall peak T waves. Option B, widened QRS interval. Option C, prolonged PR interval. Option D, inverted T waves. Option E, prominent U waves. The correct answers are options A and B and C, tall peak T waves, widened QRS interval, prolonged PR interval. Hyperkalemia is associated with tall peak T waves, a widened QRS interval, and a prolonged PR interval. Inverted T waves and prominent U waves are seen in hypokalemia. Question 7. The nurse is providing education on lithium therapy. Which of the following instructions should be included? Select all that apply. Option A, maintain a daily fluid intake of 2 to 3 liters. Option B, consume a diet rich in sodium. Option C, monitor for a fine hand tremor. Option D, restrict fluid intake to 1 liter daily. Option E, take the medication on an empty stomach. The correct answers are options A and B and C. Maintain a daily fluid intake of 2 to 3 liters. Consume a diet rich in sodium. Monitor for a fine hand tremor. Clients on lithium should maintain adequate hydration, consume a steady sodium-rich diet, and monitor for fine hand tremors. as sodium depletion can lead to lithium toxicity. Question 8. The nurse is caring for a client who was prescribed lamotrigine. The nurse understands that this medication is intended to treat which of the following conditions? Option A, epilepsy. Option B, acute spinal shock. Option C, Parkinson disease. Option D, multiple sclerosis. The correct answer is option A, epilepsy. Lamotrigine is an anticonvulsant approved to treat epilepsy to prevent seizures, and it is also indicated for maintaining mood stabilization in bipolar disorder. Question 9. The nurse is assessing a client with appendicitis. Which of the following would be an expected finding? Select all that apply. Option A, leukocytosis. Option B, fever. Option C, anorexia. Option D, nausea and vomiting. Option E, melena. The correct answers are options A and B and C and D, leukocytosis, fever, anorexia, nausea and vomiting. Clinical manifestations of appendicitis include leukocytosis, fever, anorexia, nausea, vomiting, and right lower quadrant pain. Melena is associated with gastrointestinal bleeding. Question 10. The nurse is caring for a client receiving buspirone. Which of the following client statements would indicate a therapeutic response? Option A. My anxiety has lessened and I have started going out more. Option B. I am less depressed and able to spend time with my friends. Option C. I noticed a rapid improvement in my concentration today. Option D. I have been able to fall asleep easily every night. The correct answer is option A. My anxiety has lessened and I have started going out more. Buspirone is a serotonergic medication indicated for individuals with anxiety. Reporting decreased anxiety and increased social engagement indicates a therapeutic effect. Question 11. The home health nurse is assessing a client with suspected carbon monoxide poisoning. The nurse should take which priority action? Option A, move the client outdoors. Option B, auscultate the client lung sounds. Option C, assess the client pulse oximetry. Option D, administer intravenous fluids. The correct answer is option A, move the client outdoors. Carbon monoxide poisoning is a life-threatening emergency. The immediate priority is to relocate the client away from the source of the gas and into fresh air. Question 12. The nurse is preparing a prenatal class focused on nutrition. Which of the following statements should the nurse reinforce? Option A, caffeine intake should be limited during pregnancy to less than 200 mg per day. Option B, raw sushi is acceptable to consume because of its high protein content. Option C, to increase your iron intake, choose dairy products. Option D, sodium intake must be restricted to 1 gram per day during all 3 trimesters. The correct answer is option A. Caffeine intake should be limited during pregnancy to less than 200 mg per day. Caffeine intake should be limited to less than 200 mg per day. Excessive caffeine has been linked to miscarriage or preterm birth. Question 13. A nurse is counseling 2 parents preparing for the birth of their first child. The father has sickle cell anemia and the mother is a carrier. What is the chance of their baby having sickle cell anemia? Option A, 50%. Option B, 25%. Option C, 75%. Option D, 100%. The correct answer is option A, 50%. Since the father has the disease and the mother is a carrier, there is a 50% chance the child will inherit the disease and a 50% chance the child will be a carrier. Question 14. The nurse is reinforcing education to parents of a child with sickle cell anemia. Which of the following instructions should be reinforced? Select all that apply. Option A, increase the amount of fluids throughout the day. Option B, avoid areas with high altitudes. Option C, notify the primary healthcare provider for any illnesses. Option D, perform vigorous exercise for 60 minutes a day. Option E, apply cold packs to painful joints. The correct answers are options A and B and C. Increase the amount of fluids throughout the day. Avoid areas with high altitudes. Notify the primary healthcare provider for any illnesses. Children with sickle cell anemia should increase fluids, avoid high altitudes to prevent hypoxia-induced sickling, and notify the provider of illnesses due to high infection risk. Question 15. The nurse is teaching a group of students about drug toxicity. The nurse is correct in stating which of the following? Select all that apply. Option A, naloxone is the treatment for opioid toxicity. Option B, flumazenol is the treatment for benzodiazepine toxicity. Option C, magnesium is the treatment for lead toxicity. Option D, calcium is the treatment for magnesium toxicity. Option E, acetylcysteine is the treatment for naproxen toxicity. The correct answers are options A and B. Naloxone is the treatment for opioid toxicity. Flumazenol is the treatment for benzodiazepine toxicity. Naloxone reverses opioids, and flumazenol reverses benzodiazepines. Calcium gluconate treats magnesium toxicity, not the other way around. Acetylcysteine treats acetaminophen toxicity. Question 16. The nurse is providing education to parents about toilet training for their toddler. Which of the following educational points should be included? Select all that apply. Option A, stay with the child while they are trying to use the toilet. Option B, limit sitting on the toilet to 5 to 8 minutes at a time. Option C, most children are ready to begin training between 12 and 18 months. Option D, scold the child gently if they have an accident. Option E, flush the toilet while the child is still sitting to show them how it works. The correct answers are options A and B. Stay with the child while they are trying to use the toilet. Limit sitting on the toilet to 5 to 8 minutes at a time. Parents should stay with the child for safety and limit sitting to 5 to 8 minutes to prevent frustration. Most children are not ready until 18 to 24 months. Question 17. A 4-year-old boy is recovering from abdominal surgery. As the nurse caring for the child, which of the following activities do you recommend that he prioritize to prevent respiratory complications? Option A, blowing bubbles. Option B, building blocks. Option C, playing with clay. Option D, coloring in a book. The correct answer is option A, blowing bubbles. Blowing bubbles stimulates lung expansion and prevents atelectasis and pneumonia. It serves as an excellent, age-appropriate alternative to an incentive spirometer for young children. Question 18. The nurse is assessing a 2-year-old with excessive drooling, stridor, dysphonia, and difficulty swallowing. Which of the following conditions does the nurse suspect? Option A, epiglottitis. Option B, croup. Option C, laryngotracheal bronchitis. Option D, bronchiolitis. The correct answer is option A, epiglottitis. The classic presentation of epiglottitis includes excessive drooling, dysphagia, dysphonia, and distressed respiratory efforts like stridor. This is a medical emergency. Question 19. The nurse is reinforcing education to the parents of a toddler diagnosed with bronchiolitis. What is the most likely cause of this condition? Option A, respiratory syncytial virus. Option B, Haemophilus influenza type B. Option C, rhinovirus. Option D, Streptococcus pneumoniae. The correct answer is option A, respiratory syncytial virus. Respiratory syncytial virus is the most common cause of bronchiolitis in children under 2 years of age, leading to inflammation of the small airways. Question 20. The nurse is caring for a client with a Helicobacter pylori infection. The nurse should anticipate a prescription for which of the following medications? Option A, amoxicillin. Option B, dicyclomine. Option C, valacyclovir. Option D, ondansetron. The correct answer is option A, amoxicillin. Amoxicillin is an antibiotic utilized as part of the combination therapy to eradicate Helicobacter pylori, a bacterium associated with peptic ulcer disease. Question 21. A 72-year-old male presents to the emergency department reporting the loss of his wife 8 months ago. Which findings indicate the highest risk for depression or suicide? Select all that apply. Option A, feelings of loneliness. Option B, feelings of hopelessness. Option C, recent loss of a spouse. Option D, report of a consistent bedtime routine. Option E, active participation in community events. The correct answers are options A and B and C: feelings of loneliness, feelings of hopelessness, recent loss of a spouse. Feelings of loneliness, hopelessness, and the recent loss of a spouse are significant risk factors for depression and potential suicidal ideation in older adults. Question 22. When assessing a depressed older adult client for suicide risk, which statement by the nurse demonstrates the most appropriate therapeutic communication? Option A: are you having any thoughts of harming yourself? Option B: you are not thinking about harming yourself, are you? Option C: why would you want to hurt yourself when you have so much to live for? Option D: could you describe the severity and quality of your pain? The correct answer is option A: are you having any thoughts of harming yourself? Asking the client directly about suicidal thoughts is the most appropriate and critical intervention. Leading questions or asking why discourages honest communication. Question 23. The nurse has provided medication instruction to a patient prescribed metformin. Which statement by the patient indicates a correct understanding of the teaching? Option A: this medication may cause me to have bloating or loose stools. Option B: I will need to check my blood glucose prior to taking this medication. Option C: if I eat fewer carbohydrates in a day I should skip a dose. Option D: the goal of this medication is to increase my hemoglobin A1C. The correct answer is option A: this medication may cause me to have bloating or loose stools. The most common side effect of metformin is gastrointestinal upset, including bloating and diarrhea. It does not cause hypoglycemia, so pre-dose glucose checks are not mandatory. Question 24. The nurse is caring for a group of children on the medical surgical unit. The nurse should initially follow up on the child who has which of the following findings? Option A: is receiving treatment for Hirschsprung disease and has a temperature of 101 degrees Fahrenheit. Option B: has an indwelling urinary catheter and reports burning at the insertion site. Option C: has scant blood in their newly established ostomy pouch. Option D: has friends writing words on their fiberglass cast with different colored markers. The correct answer is option A: is receiving treatment for Hirschsprung disease and has a temperature of 101 degrees Fahrenheit. A major complication of Hirschsprung disease is enterocolitis, manifested by fever, abdominal distension, and vomiting. This is a medical emergency requiring immediate intervention. Question 25. The primary healthcare provider prescribes 250 milliliters of normal saline to infuse over 75 minutes. How many milliliters per hour will be administered to the client? Option A: 200 milliliters per hour. Option B: 150 milliliters per hour. Option C: 175 milliliters per hour. Option D: 250 milliliters per hour. The correct answer is option A: 200 milliliters per hour. To find milliliters per hour, divide 75 minutes by 60 to get 1.25 hours. Then divide 250 milliliters by 1.25 hours to equal 200 milliliters per hour. Question 26. The nurse is caring for a client 3 hours postoperative following a laparoscopic appendectomy. Which client data indicates readiness for discharge home? Select all that apply. Option A: positive gag reflex. Option B: hypoactive bowel sounds. Option C: incisional pain rated 2 out of 10. Option D: blood pressure 90/60 mm of mercury. Option E: absent urinary output. The correct answers are options A and B and C: positive gag reflex, hypoactive bowel sounds, incisional pain rated 2 out of 10. A positive gag reflex, hypoactive bowel sounds, and low incisional pain are expected postoperative findings indicating stability. Hypotension and absent urine output require follow-up. Question 27. The nurse is caring for a client receiving prescribed ketorolac. Which of the following findings would indicate a therapeutic response? Select all that apply. Option A: decreased pain. Option B: decreased temperature. Option C: increased urinary output. Option D: decreased blood pressure. Option E: increased heart rate. The correct answers are options A and B. decreased pain, decreased temperature. Ketorolac is a nonsteroidal anti-inflammatory drug used for pain management and inflammation. A therapeutic response includes decreased pain and decreased fever. Question 28. Which of the following would be the most appropriate way to document a client refusal of medication? Option A. The client refused the subcutaneous heparin injection stating "I do not want that injection." Potential risks were reviewed and the client verbalized understanding. Option B. The client refused the heparin injection and yelled at me to leave the room. "I will try again later." Option C. The client stated she did not want the injection. Risks reviewed. Option D. Heparin refused during shift. Risks reviewed. The correct answer is option A. The client refused the subcutaneous heparin injection stating "I do not want that injection." Potential risks were reviewed and the client verbalized understanding. Documentation should be objective, thorough, and direct, noting the exact refusal, the education provided regarding the risks, and the client understanding. Question 29. The licensed practical nurse is collecting data on a client who just received 1 unit of packed red blood cells. Which of the following findings would indicate a therapeutic response? Option A. Capillary refill less than 3 seconds. Option B. Bounding peripheral pulses. Option C. Oral temperature 100.4 degrees Fahrenheit. Option D. Hematuria. The correct answer is option A. Capillary refill less than 3 seconds. A capillary refill of less than 3 seconds indicates optimal tissue perfusion, which is the desired therapeutic response following a blood transfusion for anemia. Question 30. The nurse is caring for a client prescribed enoxaparin. Which finding in the medical history would require follow-up with the primary healthcare physician? Option A. Recent spinal surgery. Option B. Osteoarthritis. Option C. Venous thromboembolism. Option D. Hypertension. The correct answer is option A. Recent spinal surgery. Enoxaparin is an anticoagulant. Clients who recently underwent spinal surgery are at risk for spinal epidural hematomas if they receive anticoagulation therapy. Question 31. The nurse is teaching a caregiver how to administer an injection of enoxaparin. Which statement by the caregiver requires further teaching? Option A. I should expel the air bubble before administering. Option B. I will give this injection in the abdomen. Option C. Green leafy vegetables are allowed while taking this medication. Option D. This medication may increase the risk for bleeding. The correct answer is option A. I should expel the air bubble before administering. This statement requires correction. Enoxaparin comes in prefilled syringes with an air bubble designed to ensure the full dose is administered. The air bubble should not be expelled. Question 32. The nurse is reinforcing teaching to a breastfeeding client about ways to prevent mastitis. Which statement by the client requires follow-up? Option A. I will wear a tight-fitting bra to provide compression. Option B. I must wash my hands thoroughly before breastfeeding. Option C. I must change nursing pads as soon as they become wet. Option D. I need to feed my baby every 2 to 3 hours. The correct answer is option A. I will wear a tight-fitting bra to provide compression. Wearing a tight-fitting bra can cause pressure on the breasts, making milk expression more difficult, leading to milk stasis and increasing the risk of mastitis. Question 33. The provider orders a nasogastric tube to be inserted. Place the following actions in the order that the nurse should take to correctly insert the tube. Select the first correct step. Option A. Measure the length of the tube from the nose to the earlobe to the xiphoid process. Option B. Lubricate the tip of the tube. Option C. Insert the tube in the nair pushing gently back and down. Option D. Encourage the client to swallow a few sips of water. The correct answer is option A. Measure the length of the tube from the nose to the earlobe to the xiphoid process. The very first step is to measure the tube for correct placement length by measuring from the tip of the nose to the earlobe, and then down to the xiphoid process. Question 34. The nurse is caring for a client who is unable to meet nutritional needs by mouth. After inserting a nasogastric tube, what is the most accurate way to verify placement? Option A, visualization on an abdominal X-ray. Option B, aspiration of stomach contents. Option C, checking the pH of the aspirate. Option D, auscultation of air injected into the left upper quadrant. The correct answer is option A, visualization on an abdominal X-ray. Visualization via X-ray is the gold standard for verifying the correct placement of a nasogastric tube before any feedings or medications are administered. Question 35. The nurse is preparing to remove a nasogastric tube. The nurse should instruct the client to take which action during the removal? Option A, take a deep breath and hold it. Option B, exhale forcefully. Option C, pant like a dog. Option D, swallow repeatedly. The correct answer is option A, take a deep breath and hold it. Prior to removing the tube, the nurse should tell the client to take a deep breath and hold it. This closes the glottis and prevents accidental aspiration of gastric contents. Question 36. Which of the following clients should the nurse assess first when preparing to do initial rounds? Option A, a 32-year-old female with a tracheostomy experiencing copious secretions. Option B, a diabetic client who is being discharged today. Option C, a 16-year-old client scheduled for physical therapy this morning. Option D, an 80-year-old male with a decubitus ulcer needing a dressing change. The correct answer is option A, a 32-year-old female with a tracheostomy experiencing copious secretions. A client with potential airway compromise from copious secretions should always be the highest priority based on airway, breathing, and circulation principles. Question 37. The nurse is caring for a patient who had a fenestrated tracheostomy tube placed 1 week ago. Which of the following statements are true regarding this device? Select all that apply. Option A, the patient with a fenestrated tracheostomy can speak. Option B, a fenestrated tracheostomy can be capped if the cuff is deflated. Option C, this type of tracheostomy does not require daily care. Option D, this is the only type of tracheostomy used with mechanical ventilation. Option E, it poses no risk for accidental decannulation. The correct answers are options A and B. The patient with a fenestrated tracheostomy can speak. A fenestrated tracheostomy can be capped if the cuff is deflated. A fenestrated tube has an opening that allows air to pass over the vocal cords, enabling speech. It can be capped to allow normal breathing only if the cuff is fully deflated. Question 38. The nurse is reviewing laboratory results of assigned clients. Which of the following results require immediate follow-up? Select all that apply. Option A, creatinine 2.7 mg per deciliter for a patient receiving vancomycin. Option B, potassium 3.1 milliequivalents per liter for a patient receiving bumetanide. Option C, hemoglobin A1C of 6.9% for a diabetic patient. Option D, calcium 10.8 mg per deciliter for a patient receiving hydrochlorothiazide. Option E, platelet count of 152,000 per cubic millimeter. The correct answers are options A and B, creatinine 2.7 mg per deciliter for a patient receiving vancomycin, potassium 3.1 milliequivalents per liter for a patient receiving bumetanide. A creatinine of 2.7 is critically high and indicates potential vancomycin-induced nephrotoxicity. A potassium of 3.1 is low and requires correction. Question 39. The nurse discusses negligent lawsuits with a student. Which situation is an example of negligence? Option A. The nurse fails to notify the physician of a client critical laboratory result. Option B. The nurse transcribes a new medication order exactly as written. Option C. The nurse assesses distal pulses 2 hours after a cardiac catheterization. Option D. The nurse observes assistive personnel entering an isolation room with full gear. The correct answer is option A. The nurse fails to notify the physician of a client critical laboratory result. Failure to communicate a critical laboratory result in a timely manner is a breach of the standard of care and is a classic example of negligence. Question 40. The nurse cares for a client with pulmonary tuberculosis. Which infection control measures should the nurse implement? Option A, remove any portable fans in the room. Option B, restrict visitors who are pregnant. Option C, wear a dosimeter badge during client care. Option D, place the patient further away from the nursing station. The correct answer is option A, remove any portable fans in the room. Fans should be removed from airborne isolation rooms because they can propel the transmission of the pathogen. The door must remain closed in a negative pressure room. Question 41. While monitoring a client with a myocardial infarction who is receiving tissue plasminogen activator therapy, the nurse should prioritize which assessment? Option A, observe for signs of bleeding. Option B, observe for neurological changes. Option C, monitor for signs of renal failure. Option D, check the client food diary. The correct answer is option A, observe for signs of bleeding. Tissue plasminogen activator is a potent thrombolytic medication. Bleeding is the most significant potential adverse effect, making it the priority concern. Question 42. The nurse is caring for a client on bed rest with a fractured hip. Which symptoms indicate complications due to immobility? Select all that apply. Option A, an area of non-blanchable erythema on the sacrum. Option B, crackles auscultated in the bases of the lungs. Option C, pain and swelling in the left calf. Option D, a faint yellow tinge to the skin. Option E, hyperactive bowel sounds. The correct answers are options A and B and C, an area of non-blanchable erythema on the sacrum, crackles auscultated in the bases of the lungs, pain and swelling in the left calf. Immobility can lead to pressure ulcers, non-blanchable erythema, hypostatic pneumonia, crackles in lung bases, and deep vein thrombosis, calf pain and swelling. Question 43. The nurse is reinforcing education regarding the development of pressure ulcers. Which intrinsic risk factors should be included? Option A, impaired tissue perfusion. Option B, shearing forces. Option C, friction from bed linens. Option D, moisture from incontinence. The correct answer is option A, impaired tissue perfusion. Impaired tissue perfusion is an intrinsic, or internal, risk factor for skin breakdown. Shearing, friction, and moisture are external, extrinsic factors. Question 44. The nurse is reviewing the causes of metabolic acidosis. Which of the following conditions lead to this acid-base imbalance? Select all that apply. Option A, severe diarrhea. Option B, starvation. Option C, end-stage renal disease. Option D, nasogastric tube suctioning. Option E, hyperventilation. The correct answers are options A and B and C, severe diarrhea, starvation, end-stage renal disease. Severe diarrhea leads to bicarbonate loss. Starvation causes ketoacidosis. Renal disease prevents acid excretion. Suctioning and hyperventilation cause alkalosis. Question 45. A client is admitted experiencing perspiration on the forehead, nystagmus, coarse tremors, and visual hallucinations. The nurse anticipates administering which medication? Option A, lorazepam. Option B, diphenhydramine. Option C, phenytoin. Option D, clozapine. The correct answer is option A, lorazepam. These findings indicate alcohol withdrawal syndrome. Lorazepam is a benzodiazepine commonly used to manage severe withdrawal symptoms and prevent seizures. Question 46. The nurse is collecting data on a child with bilateral lower extremity chemical burns. The nurse should take which initial action? Option A, irrigate the affected area with copious amounts of saline. Option B, cover the affected area with sterile dressings. Option C, report the suspected abuse to authorities. Option D, obtain an electrocardiogram. The correct answer is option A, irrigate the affected area with copious amounts of saline. When a client has a chemical burn, the highest priority is to copiously irrigate and dilute the chemical with saline or water to stop the burning process. Question 47. The nurse is discussing alcohol withdrawal syndrome. In what sequential order do the components of alcohol withdrawal typically manifest? Option A, mild tremors, followed by hyperthermia, followed by hallucinations. Option B, hallucinations, followed by mild tremors, followed by hyperthermia. Option C, hyperthermia, followed by hallucinations, followed by mild tremors. Option D, mild tremors, followed by hallucinations, followed by hyperthermia. The correct answer is option A, mild tremors, followed by hyperthermia, followed by hallucinations. Alcohol withdrawal progresses from mild autonomic hyperactivity such as tremors, to worsening autonomic instability like hyperthermia, and eventually to severe complications like hallucinations and delirium tremens. Question 48. The nurse is taking care of a pediatric client with encephalitis. Which of the following statements correctly describes this condition? Option A, voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Option B, infrequent and hard to pass stools lasting greater than 2 weeks. Option C, inability to pass stool due to a severe congenital fecal impaction. Option D, fecal incontinence occurring exclusively during nighttime sleep. The correct answer is option A, voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Encephalitis is defined as voluntary or involuntary fecal incontinence in a child over the age of 4 who has already been successfully toilet trained. Question 49. Which of the following parenting styles is highly controlling, expecting always to be obeyed, and inflexible with the rules? Option A, authoritarian. Option B, permissive. Option C, authentic. Option D, indifferent. The correct answer is option A, authoritarian. The authoritarian parent is a rigid disciplinarian who is highly controlling, expects to be obeyed without reason, and is inflexible with household rules. Question 50. The nurse is educating students about fetal alcohol spectrum disorders. Which of the following features are characteristic of this condition? Select all that apply. Option A, intellectual disabilities. Option B, growth delays. Option C, facial abnormalities. Option D, motor impairments. Option E, severe anxiety disorders. The correct answers are options A and B and C and D, intellectual disabilities, growth delays, facial abnormalities, motor impairments. Fetal alcohol spectrum disorders are characterized by intellectual disabilities, growth delays, distinctive facial abnormalities, and motor or behavioral impairments. Question 51. The nurse performs a home safety survey for an individual with epilepsy. Which findings require intervention by the nurse? Select all that apply. Option A, multiple feather pillows present on the bed. Option B, locks present on the bathroom doors. Option C, use of a shower chair with a handheld nozzle. Option D, scattered rugs placed on hardwood flooring. Option E, padded edges on sharp furniture. The correct answers are options A and B and D, multiple feather pillows present on the bed, locks present on the bathroom doors, scattered rugs placed on hardwood flooring. Feather pillows pose an asphyxiation risk during a seizure. Bathroom locks prevent emergency access. Scatter rugs on hard floors are significant slip and fall hazards. Question 52. An 8-year-old boy diagnosed with hemophilia is brought into the clinic for a prolonged episode of hematemesis. Which of the following describes this symptom? Option A, bloody vomit. Option B, bleeding into the joints. Option C, bleeding from the nose. Option D, dark tarry stools. The correct answer is option A, bloody vomit. Hematemesis is the medical term for vomiting blood. This is a severe complication in clients with bleeding disorders like hemophilia and requires prompt treatment. Question 53. The nurse is caring for an adolescent with hemophilia who reports severe joint pain after playing baseball. The nurse should prioritize addressing the client's Option A, active bleeding. Option B, acute pain. Option C, self-esteem. Option D, knowledge deficit. The correct answer is option A, active bleeding. Addressing the active joint bleeding, or hemarthrosis, is the absolute priority to prevent shock and permanent joint destruction. Pain management follows bleeding control. Question 54. The nurse is performing a breast exam on a 65-year-old client. Where is the most common anatomical location to find a malignant breast mass? Option A, the upper outer quadrant. Option B, the upper inner quadrant. Option C, the lower outer quadrant. Option D, the lower inner quadrant. The correct answer is option A, the upper outer quadrant. Approximately 50% of breast cancers are detected in the upper outer quadrant, as the breast tissue is thicker and extends into the axillary region. Question 55. What interventions should the nurse anticipate when providing care for an infant who has undergone surgical repair of an anorectal malformation? Select all that apply. Option A, administration of stool softeners like docusate. Option B, initiation of a high-fiber diet. Option C, monitoring the client for signs of infection. Option D, administration of antidiarrheal medications like loperamide. Option E, initiation of a high-calorie, low-fiber diet. The correct answers are options A and B and C, administration of stool softeners like docusate, initiation of a high-fiber diet, monitoring the client for signs of infection. Postoperative care includes giving stool softeners and a high-fiber diet to prevent constipation and strain on the surgical site, along with strict infection monitoring. Question 56. The emergency department nurse is caring for a child who swallowed a toy. The child has trouble breathing, is conscious, but is not making any sounds. The nurse should immediately: Option A, perform abdominal thrusts. Option B, apply a bag valve mask. Option C, instruct the client to cough forcefully. Option D, perform a blind finger sweep of the mouth. The correct answer is option A, perform abdominal thrusts. A conscious child who cannot breathe or make sounds has a severe upper airway obstruction. Abdominal thrusts, or the Heimlich maneuver, should be performed immediately. Question 57. The nurse is working on a pediatric floor when the hospital receives a tornado warning. Which action should the nurse take to best protect a patient on oxygen therapy? Option A, move the patient as close to the interior of the room as possible. Option B, remove the oxygen and carry the child to a basement shelter. Option C, close all of the doors and open the windows slightly. Option D, instruct the family to leave the hospital immediately. The correct answer is option A, move the patient as close to the interior of the room as possible. During a tornado warning, patients should be moved away from windows and as close to the interior walls or hallways as possible to protect against flying debris. Question 58. After a traumatic amputation, the nurse documents the diagnosis of body image disturbance related to changes in appearance secondary to: Option A, loss of a body part. Option B, severe physical trauma. Option C, chronic vascular disease. Option D, loss of peripheral body function. The correct answer is option A, loss of a body part. The nursing diagnosis should specifically reference the loss of a body part. This gives precise, actionable information to the healthcare team regarding the exact cause of the disturbance. Question 59. Which of the following food choices would be highly suitable for a client with iron deficiency anemia? Select all that apply. Option A, quinoa. Option B, liver. Option C, spinach. Option D, beans. Option E, dairy products. The correct answers are options A and B and C and D: quinoa, liver, spinach, beans. Quinoa, liver, spinach, and beans are all excellent sources of dietary iron. Dairy products are poor sources of iron and can actually inhibit iron absorption. Question 60. Which of the following are clinical manifestations of the aging immune system that increase susceptibility to illness in older adults? Option A, increased autoimmune responses. Option B, increased lymphatic tissue volume. Option C, increased circulation of active lymphocytes. Option D, increased T and B cell production. The correct answer is option A, increased autoimmune responses. Aging leads to immune senescence, resulting in an increased risk of infections and an increase in autoimmune responses, placing the elderly at higher risk for conditions like rheumatoid arthritis. Question 61. The nurse is assigned a pediatric client with impetigo. Which of the following actions should the nurse take to prevent the spread of this disease? Option A. Initiate contact precautions. Option B. Initiate standard precautions. Option C. Initiate droplet precautions. Option D. Initiate airborne precautions. The correct answer is option A. Initiate contact precautions. Impetigo is a highly contagious bacterial skin infection spread by direct contact. The nurse must initiate contact precautions, which require wearing a gown and gloves. Question 62. The nurse is reinforcing teaching with the parents of a child diagnosed with impetigo. Which statements indicate effective understanding? Select all that apply. Option A. It is the most common bacterial skin infection between the ages of 2 and 5. Option B. Impetigo is usually not a systemic infection. Option C. I should keep my child home from swim practice until the blisters heal. Option D. I should not share my child's linens with anyone else in the house. Option E. The causative agent of impetigo is Haemophilus influenza. The correct answers are options A and B and C and D. It is the most common bacterial skin infection between the ages of 2 and 5. Impetigo is usually not a systemic infection. I should keep my child home from swim practice until the blisters heal. I should not share my child's linens with anyone else in the house. Impetigo is a localized, non-systemic infection common in young children. It requires isolation from swimming and avoidance of sharing linens to prevent transmission. Question 63. The nurse is raising awareness about cystic fibrosis. Which statement best explains this condition? Option A. It is an inherited disease causing excessive thick mucus to build up in the body and cause blockages. Option B. It is an infectious disease causing inflammation and fluid accumulation in the alveoli. Option C. It is an inherited disease that causes hyperreactivity and spasms of the airway. Option D. It is an acquired autoimmune disease causing swelling of the epiglottis. The correct answer is option A. It is an inherited disease causing excessive thick mucus to build up in the body and cause blockages. Cystic fibrosis is an inherited autosomal recessive disorder that causes exocrine glands to produce thick, sticky mucus, leading to severe respiratory and digestive blockages. Question 64. The nurse is speaking with a patient undergoing chemotherapy who says they want to beat cancer using complementary therapies. What is the most appropriate response? Option A. Tell me more about what you mean when you say complementary therapies. Option B. Complementary therapies are not safe to use with your chemotherapy. Option C. I would be desperate to try anything if I had cancer too. Option D. Let us go get your healthcare provider so that we may discuss it with him. The correct answer is option A. Tell me more about what you mean when you say complementary therapies. Asking the client to elaborate is an open-ended, therapeutic technique that explores the client's interests and helps the nurse understand their specific needs before intervening. Question 65. Which of the following medications would the nurse expect to be administered to a premature newborn with respiratory distress syndrome? Option A. Calphoscarol. Option B. Theophylline. Option C. Dexamethasone. Option D. Albuterol. The correct answer is option A. Calphoscarol. Calphoscarol is a synthetic pulmonary surfactant. Premature infants lack sufficient surfactant, leading to respiratory distress syndrome, and exogenous surfactant administration stabilizes their alveoli. Question 66. Which of the following clients should the licensed practical nurse attend to first? Option A. A patient in an arm cast 2 days postoperatively reporting numbness and tingling. Option B. A client newly diagnosed with hepatitis A reporting stomach pain and itchy skin. Option C. A postoperative prostatectomy patient complaining of bladder spasms. Option D. A patient with a newly placed nasogastric tube complaining of a plugged nose. The correct answer is option A. A patient in an arm cast 2 days postoperatively reporting numbness and tingling. Numbness and tingling in a cast extremity indicates potential compartment syndrome or neurovascular compromise, which is a medical emergency requiring immediate attention. Question 67. The nurse is caring for a patient who is experiencing acute mania. Which of the following actions should be prioritized by the nurse? Option A. Provide high-calorie small frequent meals. Option B. Plan structured solitary activities. Option C. Initiate a psychiatry referral. Option D. Encourage the client to sit and read quietly. The correct answer is option A. Provide high-calorie small frequent meals. Clients experiencing acute mania have severe psychomotor agitation and exert excessive energy, often ignoring hunger. Providing high-calorie, easily consumable meals meets their basic physiological needs. Question 68. The practical nurse is informed that a client is at risk for developing hypercalcemia. The nurse should monitor for which signs and symptoms? Select all that apply. Option A. Decreased deep tendon reflexes. Option B. Hypoactive bowel sounds. Option C. Palpitations. Option D. Irritability. Option E. Muscle spasms and tetany. The correct answers are options A and B and C. Decreased deep tendon reflexes, hypoactive bowel sounds, palpitations. Hypercalcemia causes a sedative effect on the nervous system, leading to decreased deep tendon reflexes, lethargy, hypoactive bowel sounds, and cardiac dysrhythmias like palpitations. Question 69. The nurse is preparing to perform a fetal non-stress test on a patient who is 34 weeks pregnant. Which action is most important prior to this procedure? Option A. Position the patient in a left-lying Sims position. Option B. Explain the possible risk of inducing early labor. Option C. Confirm the patient has been fasting for 4 hours. Option D. Administer oxytocin to stimulate uterine contractions. The correct answer is option A. Position the patient in a left-lying Sims position. The patient should be placed in a lateral Sims position, preferably on the left side, to prevent supine hypotensive syndrome and promote optimal oxygen delivery to the fetus. Question 70. Which of the following represents the most accurate education for fall injury prevention in the home of an elderly client? Option A. Remove all throw rugs, clear pathways of furniture, and wear non-skid footwear. Option B. Use solid chairs without armrests and keep cordless phones nearby. Option C. Install raised toilet seats and place throw rugs near the sink to catch dripping water. Option D. Use the handrails on stairs and ensure flowy pants are held up with a belt. The correct answer is option A. Remove all throw rugs, clear pathways of furniture, and wear non-skid footwear. Removing tripping hazards like throw rugs and furniture clutter, along with wearing non-skid footwear, are the most effective strategies to prevent falls in the elderly. Question 71. The nurse is caring for a client with borderline personality disorder. Which of the following actions should the nurse take? Select all that apply. Option A. Assess the patient for suicidal ideation. Option B. Establish therapeutic boundaries. Option C. Encourage independent decision-making. Option D. Rotate staff assignments constantly to prevent attachment. Option E. Allow the client to dictate the timing of their therapy sessions. The correct answers are options A and B and C. Assess the patient for suicidal ideation. Establish therapeutic boundaries. Encourage independent decision-making. Clients with borderline personality disorder require strict therapeutic boundaries, frequent assessment for self-harm or suicide, and encouragement to develop independence in decision-making. Question 72. A client is receiving an infusion of 1,300 units of heparin per hour. The bag contains 25,000 units in 500 milliliters. How many milliliters will the client receive in 8 hours? Option A. 208 milliliters. Option B. 26 milliliters. Option C. 104 milliliters. Option D. 416 milliliters. The correct answer is option A. 208 milliliters. 1,300 divided by 25,000 equals 0.052. Multiply by 500 to get 26 milliliters per hour. 26 times 8 hours equals 208 milliliters. Question 73. The nurse is discharging a client following a total knee arthroplasty. Which information should the nurse reinforce in the discharge teaching? Option A. You will need to resume your prescribed anticoagulants. Option B. You will use a wheelchair to get around for the next month. Option C. Placing a pillow directly under your knee will help with the pain. Option D. You may ice the surgical site for 1 full hour at a time. The correct answer is option A. You will need to resume your prescribed anticoagulants. Following joint replacement, clients are at high risk for venous thromboembolism. Evidence-based guidelines require resuming anticoagulant prophylaxis for a minimum of 14 days. Question 74. A nurse is caring for a client with fluid volume overload due to heart failure. Which intervention should the nurse implement? Select all that apply. Option A. Administer diuretics as prescribed. Option B. Monitor daily weights. Option C. Collect data on lung sounds for crackles. Option D. Restrict fluid intake to 500 milliliters per day. Option E. Encourage a high-sodium diet. The correct answers are options A and B and C. Administer diuretics as prescribed. Monitor daily weights. Collect data on lung sounds for crackles. Managing fluid volume overload involves administering prescribed diuretics, strictly monitoring daily weights, and listening to lung sounds for signs of pulmonary edema. Question 75. During morning care, the nurse observes a newly reddened area over the client's sacrum that does not blanch. What is the most appropriate next action? Option A. Perform and document a focused assessment of skin integrity. Option B. Correct the initial admission assessment form. Option C. Redo the entire head-to-toe assessment. Option D. Conduct and document an emergency rapid response assessment. The correct answer is option A. Perform and document a focused assessment of skin integrity. A newly identified reddened area over a bony prominence requires a prompt, focused skin assessment to determine the stage of the pressure injury and update the care plan. Question 76. When the nurse begins to irrigate a Salem sump tube, she notices that the gastric drainage is dark brown. What is the first intervention the nurse should take? Option A. Perform a Hemoccult test on the contents. Option B. Irrigate the tube and check the returns. Option C. Remove the tube from the suction source. Option D. Check the pH of the gastric contents. The correct answer is option A. Perform a Hemoccult test on the contents. Dark brown or coffee ground drainage indicates the potential presence of old blood in the gastrointestinal tract. The first intervention is to test the fluid for occult blood. Question 77. The nurse is caring for assigned postpartum clients. The nurse recognizes that the client at greatest risk for postpartum hemorrhage is the client who experienced Option A. Uterine atony and delivered with the assistance of forceps. Option B. Postpartum urinary incontinence and diuresis. Option C. An active outbreak of genital herpes and had a cesarean section. Option D. Gestational diabetes and has postpartum hyperglycemia. The correct answer is option A. Uterine atony and delivered with the assistance of forceps. Uterine atony is the most common cause of postpartum hemorrhage. The use of assistive instruments like forceps further increases the risk due to potential birth canal trauma. Question 78. Which action should the nurse take to most effectively reduce the incidence of hospital-associated urinary tract infections? Option A. Minimize the use of an indwelling urinary catheter. Option B. Delegate all perineal hygiene to unlicensed assistive personnel. Option C. Review intake and output charting for fluid imbalances. Option D. Request random urine analysis from the primary healthcare provider weekly. The correct answer is option A. Minimize the use of an indwelling urinary catheter. The most effective method to prevent catheter-associated urinary tract infections is to avoid inserting them unnecessarily and remove them as soon as medically possible. Question 79. The nurse is triaging phone calls in the prenatal clinic. The nurse should immediately follow up with the pregnant client who reports Option A, lower back pain that increases with walking at 38 weeks gestation. Option B, a fluttering sensation in the abdomen at 16 weeks gestation. Option C, intermittent leg cramping with ankle swelling at 28 weeks gestation. Option D, occasional heartburn after eating spicy foods at 30 weeks gestation. The correct answer is option A, lower back pain that increases with walking at 38 weeks gestation. Lower back pain that radiates to the abdomen and increases with walking is a classic sign of true labor contractions. At 38 weeks, this client requires immediate evaluation. Question 80. The nurse knows that which of the following are possible causes of constipation in the pediatric client. Select all that apply. Option A, Hirschsprung disease. Option B, spina bifida. Option C, changes in daily routine. Option D, administration of iron supplements. Option E, excessive intake of dietary fiber. The correct answers are options A and B and C and D. Hirschsprung disease, spina bifida, changes in daily routine, administration of iron supplements. Constipation in children can be caused by congenital disorders like Hirschsprung disease and spina bifida, lifestyle changes, and side effects of iron supplementation. Question 81. A client in the post-anesthesia care unit is semiconscious and experiencing dyspnea. What should the nurse first action be? Option A, reposition the client to keep the tongue forward. Option B, place a pillow securely under the client head. Option C, administer oxygen via a non-rebreather mask. Option D, perform a blind finger sweep of the airway. The correct answer is option A, reposition the client to keep the tongue forward. The tongue is the most common cause of airway obstruction in a semiconscious client. Repositioning the client in a side-lying position prevents the tongue from occluding the pharynx. Question 82. While reviewing a client medication list, the nurse identifies which of the following as calcium channel blockers. Select all that apply. Option A, nifedipine. Option B, verapamil. Option C, amlodipine. Option D, propranolol. Option E, digoxin. The correct answers are options A and B and C, nifedipine, verapamil, amlodipine. Nifedipine, verapamil, and amlodipine are calcium channel blockers used to treat hypertension and arrhythmias. Propranolol is a beta blocker, and digoxin is a cardiac glycoside. Question 83. While working in the emergency department, a child arrives with an avulsion fracture to the left tibia. The nurse knows this type of fracture involves option A, a piece of the bone being pulled away by a tendon or ligament. Option B, the whole cross-section of the bone being cleanly fractured. Option C, a fracture resulting from an underlying disease process rather than trauma. Option D, a fracture that affects only one side of the bone leaving the other intact. The correct answer is option A, a piece of the bone being pulled away by a tendon or ligament. An avulsion fracture occurs when an extreme force causes a ligament or tendon to tear away a small fragment of the bone it is attached to. Question 84. The nurse plans care for a client admitted with Haemophilus influenza type B meningitis. When entering the room, the nurse must don which piece of personal protective equipment? Option A, surgical mask. Option B, boot covers. Option C, sterile gown. Option D, N95 respirator. The correct answer is option A, surgical mask. Haemophilus influenza meningitis is transmitted via large respiratory droplets. Droplet precautions require the nurse to wear a standard surgical mask when within 3 feet of the client. Question 85. The nurse is admitting a child diagnosed with acute epiglottitis. During the admission history, which vaccination should the nurse specifically ask the mother about? Option A, Haemophilus influenza type B vaccine. Option B, measles, mumps and rubella vaccine. Option C, tetanus, diphtheria and pertussis vaccine. Option D, varicella vaccine. The correct answer is option A, Haemophilus influenza type B vaccine. Haemophilus influenza type B is the most common bacterial cause of epiglottitis. The incidence of this life-threatening emergency has drastically decreased due to the HIB vaccine. Question 86. The nurse is participating in a project to reduce urinary tract infections for older adults in long-term care. Which intervention should the nurse recommend? Select all that apply. Option A. The addition of more liquids to meal trays. Option B. A staff in service on proper hand hygiene. Option C. Standardizing the dosing times of prescribed diuretics. Option D. Audio reminders for turning bed-bound clients. Option E. Routine administration of prophylactic antibiotics. The correct answers are options A and B. The addition of more liquids to meal trays. A staff in service on proper hand hygiene. Increasing oral fluid intake combats dehydration, a major risk factor for UTIs in the elderly. Staff education on hand hygiene is essential for infection control. Question 87. The nurse is caring for a postoperative client at risk for a venous thromboembolism. The nurse anticipates the provider will prescribe which prophylactic medication? Option A. Enoxaparin. Option B. Tranexamic acid. Option C. Ropinirole. Option D. Alteplase. The correct answer is option A. Enoxaparin. Enoxaparin is a low molecular weight heparin administered subcutaneously. It is the standard of care for preventing deep vein thrombosis in high-risk postoperative clients. Question 88. During a busy shift, the nurse appropriately delegates ambulation to an unlicensed assistive personnel. After delegating, what is the nurse's primary responsibility? Option A. Follow up with the assistive personnel to ensure completion and evaluate the outcome. Option B. Document the completion of the task in the medical record immediately. Option C. Observe the assistive personnel for the entire duration of the task. Option D. Make a list of tasks not yet completed to pass on to the next shift. The correct answer is option A. Follow up with the assistive personnel to ensure completion and evaluate the outcome. While tasks can be delegated, accountability cannot. The nurse must follow up to verify the task was completed safely and evaluate the patient response. Question 89. The nurse is teaching a new graduate about insulin administration for a type 1 diabetic client. Which points should be included? Select all that apply. Option A. Administer insulin subcutaneously, not intramuscularly. Option B. Regular insulin can be administered intravenously in emergency situations. Option C. Rotate injection sites frequently to prevent lipohypertrophy. Option D. Long-acting insulins should be mixed with rapid-acting insulins to save syringes. Option E. Massage the injection site vigorously after administration. The correct answers are options A and B and C. Administer insulin subcutaneously, not intramuscularly. Regular insulin can be administered intravenously in emergency situations. Rotate injection sites frequently to prevent lipohypertrophy. Insulin is given subcutaneously. Regular insulin is the only type given intravenously, and rotating sites prevents tissue damage. Long-acting insulins must never be mixed. Question 90. The nurse should recognize that which of the following diabetic clients are at the highest risk for developing hypoglycemia. Select all that apply. Option A. A client with diabetic ketoacidosis receiving a continuous intravenous infusion of regular insulin. Option B. A client who received 6 units of Lispro insulin 1 hour ago and has not eaten. Option C. A client receiving methylprednisolone for an asthma exacerbation. Option D. A client with pancreatitis receiving total parenteral nutrition. Option E. A client who is nothing by mouth following a bypass graft and receiving no insulin. The correct answers are options A and B. A client with diabetic ketoacidosis receiving a continuous intravenous infusion of regular insulin. A client who received 6 units of Lispro insulin 1 hour ago and has not eaten. Continuous intravenous insulin rapidly drops blood glucose. Lispro is a rapid-acting insulin. If the client does not eat within 15 minutes, severe hypoglycemia can occur. Question 91. A nurse is caring for a client 24 hours post-coronary artery bypass graft. The care plan includes decreased cardiac output. Which nursing intervention is most critical? Option A. Monitor the client daily weight and calculate the fluid balance change. Option B. Administer prescribed opioids around the clock. Option C. Monitor the client arterial blood gas continuously. Option D. Monitor mediastinal chest tubes for hourly output. The correct answer is option A. Monitor the client daily weight and calculate the fluid balance change. Daily weight is the most reliable indicator of fluid volume status. In a client with decreased cardiac output, monitoring for rapid fluid retention is crucial to prevent heart failure. Question 92. A nurse is preparing to administer a RhoGAM injection to a postpartum client. Which situation is not a contraindication for the administration of this injection? Option A. Administration of the injection within 72 hours after delivery. Option B. Administration to a client with a history of anaphylaxis to human immunoglobulins. Option C. Administration to a female client who is Rh positive. Option D. Administration to a client who delivered an Rh negative infant. The correct answer is option A. Administration of the injection within 72 hours after delivery. RhoGAM must be administered intramuscularly within 72 hours after birth to prevent Rh sensitization in an Rh negative mother who delivered an Rh positive infant. Question 93. The healthcare provider prescribes ondansetron 0.15 mg per kilogram intravenously to a pediatric client who weighs 40 pounds. The vial reads 2 mg per milliliter. How many milliliters will the nurse administer? Option A. 1.4 milliliters. Option B. 2.7 milliliters. Option C. 0.7 milliliters. Option D. 3.0 milliliters. The correct answer is option A. 1.4 milliliters. 40 pounds divided by 2.2 equals 18.18 kilograms. Multiplied by 0.15 equals 2.7 milligrams. Divided by 2 equals 1.36, rounded to 1.4 milliliters. Question 94. The nurse is caring for a client prescribed a calcium channel blocker for hypertension. The nurse knows that which food must be strictly avoided while taking this medication. Option A. Grapefruit. Option B. Eggs. Option C. Bananas. Option D. Spinach. The correct answer is option A. Grapefruit. Grapefruit contains compounds that block the liver enzymes responsible for metabolizing calcium channel blockers, leading to toxic medication levels and profound hypotension. Question 95. A nursing assistant reports that a client with chronic obstructive pulmonary disease did not receive an annual flu or pneumonia vaccine. Which vital sign must be reported to the nurse immediately? Option A. Oral temperature of 101.4 degrees Fahrenheit. Option B. Blood pressure of 150/80 millimeters of mercury. Option C. Heart rate of 92 beats per minute. Option D. Respiratory rate of 26 breaths per minute. The correct answer is option A. Oral temperature of 101.4 degrees Fahrenheit. An elevated temperature indicates a potential respiratory infection. Clients with COPD lacking vaccinations are at extreme risk for life-threatening pneumonia. Question 96. The charge nurse must transfer a client from the maternity unit to the medical surgical unit to make a bed available. It would be most appropriate to transfer the client who is: Option A. Postpartum following a cesarean section and needs routine surgical wound monitoring. Option B. Experiencing preterm contractions and requires continuous fetal monitoring. Option C. Admitted for severe preeclampsia and is experiencing a frontal headache. Option D. In her second trimester undergoing a non-stress test for suspected gestational diabetes. The correct answer is option A. Postpartum following a cesarean section and needs routine surgical wound monitoring. A postpartum cesarean client primarily requires post-surgical nursing care, which medical surgical nurses are highly competent to provide, making her the safest transfer. Question 97. When providing care for a client with a history of intravenous drug use, which statement accurately highlights the primary infection risk associated with this behavior? Option A. Sharing needles significantly increases the risk of contracting blood-borne pathogens like HIV and hepatitis C. Option B, drug use leads to poor dietary habits resulting in profound immunosuppression. Option C, intravenous drug use exclusively leads to localized skin infections at the injection sites. Option D, the primary risk is contracting sexually transmitted diseases due to impaired judgment. The correct answer is option A. Sharing needles significantly increases the risk of contracting blood-borne pathogens like HIV and hepatitis C. The direct sharing of contaminated needles places intravenous drug users at an extreme risk for transmitting blood-borne viruses such as HIV, hepatitis B, and hepatitis C. Question 98. The nurse prepares a client for a scheduled percutaneous coronary intervention. Which client statement should be reported to the primary healthcare provider immediately? Option A. I took my metformin this morning. Option B. I get anxious when I am in closed spaces. Option C. I am allergic to pollen and dust. Option D. I may feel a warm sensation during the procedure. The correct answer is option A. I took my metformin this morning. The contrast dye used in a percutaneous coronary intervention can cause acute kidney injury. If metformin was taken within 48 hours, the risk of severe lactic acidosis increases. Question 99. The nurse is caring for assigned clients. The nurse should recognize that the client at greatest risk for developing compartment syndrome is the client who has: Option A, a left tibial fracture that was recently placed in a rigid cast. Option B, chronic osteomyelitis of the right femur. Option C, swelling in the ankles and is wearing compression stockings. Option D, skin traction following a left hip fracture. The correct answer is option A, a left tibial fracture that was recently placed in a rigid cast. A fresh fracture causes internal bleeding and swelling. When enclosed in a rigid cast, this swelling cannot expand outward, compressing nerves and vessels, leading to compartment syndrome. Question 100. The nurse is caring for a client requesting to leave against medical advice. The nurse barricades the door because they feel the client is not safe to go home. The nurse is demonstrating: Option A, false imprisonment. Option B, negligence. Option C, invasion of privacy. Option D, assault and battery. The correct answer is option A, false imprisonment. Refusing to let a competent client leave against medical advice and physically obstructing their exit constitutes the intentional tort of false imprisonment. Question 101. The triage nurse assesses a client reporting recent travel to West Africa with a fever, conjunctival injection, severe rash, vomiting, and bloody stool. The nurse suspects the client may have: Option A, Ebola virus disease. Option B, pulmonary tuberculosis. Option C, inhalation anthrax. Option D, viral encephalitis. The correct answer is option A, Ebola virus disease. Recent travel to West Africa combined with hemorrhagic fever symptoms, such as bloody stool and conjunctival injection, is a classic presentation of Ebola virus disease. Question 102. The nurse is anticipating the arrival of a client exposed to inhalation anthrax. The nurse anticipates that the primary healthcare provider will prescribe which medication? Option A, ciprofloxacin. Option B, acyclovir. Option C, oseltamivir. Option D, fluconazole. The correct answer is option A, ciprofloxacin. Anthrax is a severe bacterial infection. Inhalation anthrax is treated aggressively with a combination of antibiotics, primarily focusing on ciprofloxacin or doxycycline for up to 60 days. Question 103. A 1-year-old infant requires a prolonged hospitalization. This experience may most significantly delay the progression of which physical developmental milestone? Option A, walking. Option B, sitting unsupported. Option C, crawling. Option D, rolling over. The correct answer is option A, walking. By 12 months of age, infants typically begin to pull to a stand and take their first steps. Prolonged bed rest and hospitalization can significantly delay the onset of walking. Question 104. The nurse is aware that which of the following maternal viral infections during the first trimester significantly increases the risk of congenital heart defects in the fetus. Option A, rubella. Option B, parainfluenza. Option C, measles. Option D, rhinovirus. The correct answer is option A, rubella. Maternal rubella infection, especially during the first 8 weeks of gestation, is a known teratogen that causes severe congenital heart defects, deafness, and cataracts. Question 105. The nurse is assisting a provider with a lumbar puncture on a 9-year-old client. In which of the following positions should the nurse place the client? Option A, side lying with knees pulled up to the chest. Option B, prone with arms extended overhead. Option C, supine with a pillow under the lumbar spine. Option D, Trendelenburg with the head tilted downward. The correct answer is option A, side lying with knees pulled up to the chest. The fetal, side lying position with the knees flexed to the chest separates the lumbar vertebrae, providing optimal access to the subarachnoid space for the spinal tap. Question 106. The nurse supervises a new graduate caring for an infant immediately following surgical repair of an imperforate anus. Which action by the new graduate requires immediate intervention? Option A, obtains a core temperature using a rectal thermometer. Option B, positions the child side lying with the hips elevated. Option C, auscultates bowel sounds in all 4 abdominal quadrants. Option D, secures the indwelling urinary catheter bag to the bed frame. The correct answer is option A, obtains a core temperature using a rectal thermometer. Inserting a rectal thermometer can cause severe trauma and disruption to the fragile surgical suture line of a newly repaired imperforate anus. Axillary temperatures should be used. Question 107. Which of the following medical terms refers to the fine, soft downy hair present on the shoulders, back, and forehead of premature newborns? Option A, lanugo. Option B, vernix caecessa. Option C, milia. Option D, Mongolian spots. The correct answer is option A, lanugo. Lanugo is the fine, unpigmented fetal hair that covers the body. It helps insulate the fetus and is typically shed right before or shortly after birth. Question 108. A client with a history of severe falls is admitted to the medical unit. The nurse should plan to implement which priority intervention to reduce this client risk of falling? Option A, verify that the bed alarm is enabled during client rounding. Option B, implement a strict physical restraint policy. Option C, encourage the client to ambulate independently to build strength. Option D, keep the room completely dark at night to promote sleep. The correct answer is option A, verify that the bed alarm is enabled during client rounding. Bed alarms alert the nursing staff immediately if a high-risk client attempts to get out of bed unassisted, allowing for rapid intervention to prevent a fall. Question 109. During a physical assessment, which of the following observations is not considered part of the visual inspection phase? Option A, noting an irregular heart rate and rhythm. Option B, observing that the skin is clear and pink. Option C, noting bilateral symmetry of the chest wall. Option D, observing the client posture and gait. The correct answer is option A, noting an irregular heart rate and rhythm. Determining an irregular heart rate and rhythm requires auscultation with a stethoscope or palpation of a pulse, neither of which are visual inspection techniques. Question 110. A client presents to the emergency department with chest pain. Which of the following cardiac isoenzymes is the most specific biomarker for diagnosing a myocardial infarction? Option A, troponin. Option B, myoglobin. Option C, creatinine kinase. Option D, lactic acid. The correct answer is option A, troponin. Troponin is the most sensitive and specific cardiac biomarker for myocardial injury. Levels elevate within 3 to 4 hours of infarction and remain elevated for up to 3 weeks. Question 111. Which of the following immunizations is a priority recommendation for a 75-year-old client with a history of cardiovascular disease? Option A, pneumococcal vaccine. Option B. Hepatitis A vaccine. Option C. Lyme disease vaccine. Option D. Human papillomavirus vaccine. The correct answer is option A. Pneumococcal vaccine. The pneumococcal vaccine is a critical priority for all adults over 65, especially those with chronic conditions, to prevent life-threatening bacterial pneumonia. Question 112. The nurse is reinforcing teaching to a client newly prescribed carbamazepine. Which of the following dietary instructions must the nurse include? Option A. Avoid taking this medication with grapefruit juice. Option B. Consume an extra serving of dairy with every dose. Option C. This medication must be taken on an empty stomach. Option D. Increase your intake of dark green leafy vegetables. The correct answer is option A. Avoid taking this medication with grapefruit juice. Carbamazepine is an anticonvulsant. Grapefruit juice inhibits liver cytochrome enzymes, which prevents the breakdown of the drug, leading to toxic serum levels of carbamazepine. Question 113. A client recently returned from international travel presents to the emergency room with severe shortness of breath and suspected severe acute respiratory syndrome. What is the nurse's first intervention? Option A. Place the client on airborne and contact precautions. Option B. Obtain blood and sputum for culture. Option C. Administer a high-dose intravenous corticosteroid. Option D. Infuse normal saline at 100 ml per hour. The correct answer is option A. Place the client on airborne and contact precautions. Severe acute respiratory syndrome is highly contagious and transmitted via respiratory droplets and direct contact. Immediate airborne and contact isolation is the absolute priority to protect staff and clients. Question 114. The nurse is planning care for a child brought to the emergency department following a near-drowning incident. It is a priority for the nurse to have which item ready at the bedside? Option A. Advanced airway equipment and suction. Option B. Warm intravenous isotonic fluids. Option C. A rectal thermometer. Option D. A cardiac defibrillator. The correct answer is option A. Advanced airway equipment and suction. Drowning causes severe hypoxia and anoxic brain injury. Establishing and maintaining a patent airway to deliver oxygen is the absolute highest priority in the resuscitation sequence. Question 115. The triage nurse is assessing a non-English speaking client. The client shakes his head no when asked if he wants an interpreter. What is the most appropriate action for the nurse to take? Option A. Request a certified medical interpreter from the hospital service. Option B. Ask a bilingual receptionist to assist with translation. Option C. Use an internet translation application on a mobile phone. Option D. Rely on the client family members to translate medical terms. The correct answer is option A. Request a certified medical interpreter from the hospital service. Using a certified medical interpreter is required to ensure accurate translation of complex medical terminology and to legally protect the client's right to privacy and informed consent. Question 116. A female client presents to the clinic and states she had a positive over-the-counter home pregnancy test. The nurse understands this is considered which level of pregnancy confirmation? Option A. A probable sign of pregnancy. Option B. A presumptive sign of pregnancy. Option C. A positive sign of pregnancy. Option D. A definitive diagnostic sign of pregnancy. The correct answer is option A. A probable sign of pregnancy. A positive pregnancy test detects human chorionic gonadotropin, making it a strong probable sign of pregnancy. However, it requires an ultrasound or fetal heartbeat for positive confirmation. Question 117. The nurse is discussing documentation standards with a nursing student. Which statement accurately describes who is responsible for documenting client care? Option A. All staff members must independently document the specific care that they personally provided. Option B. The registered nurse must document all care provided by the nursing assistants. Option C. Only the licensed practical nurse documents vital signs taken by the assistive personnel. Option D. The primary physician is responsible for documenting all nursing interventions. The correct answer is option A. All staff members must independently document the specific care that they personally provided. Every healthcare professional, including unlicensed personnel, is legally responsible for accurately documenting the specific care, observations, and vital signs they personally perform. Question 118. Which of the following tasks would be appropriate for a registered nurse to delegate to a licensed practical nurse? Select all that apply. Option A. Obtaining an occult blood sample from a client with ulcerative colitis. Option B. Adjusting a client's cervical traction device as ordered by the physician. Option C. Developing the initial care plan for a newly admitted client. Option D. Administering intravenous push pain medications to an unstable patient. Option E. Providing routine tracheostomy care to a stable ventilator patient. The correct answers are options A and B and E. Obtaining an occult blood sample from a client with ulcerative colitis. Adjusting a client's cervical traction device as ordered by the physician. Providing routine tracheostomy care to a stable ventilator patient. Collecting specimens, adjusting traction under orders, and performing routine tracheostomy care on stable clients are all within the established scope of practice for a licensed practical nurse. Question 119. A hospice client has acute bone pain related to metastatic cancer. What is the most accurate way for the nurse to assess the client level of pain? Option A. Ask the client to rate the pain on a scale from 0 to 10. Option B. Note observations about the client facial expressions and guarding behavior. Option C. Check the client vital signs before and after administering pain medication. Option D. Ask the family how much pain they believe the client is in. The correct answer is option A. Ask the client to rate the pain on a scale from 0 to 10. Pain is a subjective experience. The client self-report, using a standardized numerical scale, is the single most reliable indicator of the existence and intensity of pain. Question 120. While administering digoxin to an infant in congestive heart failure, the nurse knows it is critical to monitor which of the following electrolytes. Option A. Potassium. Option B. Sodium. Option C. Phosphorus. Option D. Calcium. The correct answer is option A. Potassium. Hypokalemia severely increases the risk of life-threatening digoxin toxicity. The nurse must monitor serum potassium closely, especially if the infant is concurrently taking potassium-wasting diuretics. Question 121. The physician has ordered a 24-hour urine specimen collection. After explaining the procedure, the client provides the first void. What should the nurse do with this first specimen? Option A. Discard it and mark the time to begin the 24-hour collection period. Option B. Save it in the collection container on ice. Option C. Test it for protein and then discard it. Option D. Send it to the laboratory immediately as the baseline sample. The correct answer is option A. Discard it and mark the time to begin the 24-hour collection period. The first void represents old urine produced before the test began. It must be discarded, and the exact time is noted as the official start of the 24-hour collection. Question 122. A client receiving maintenance intravenous fluids complains of pain at the insertion site. The nurse notes swelling, redness, and a slowed infusion rate. Which action should the nurse take first? Option A. Stop the infusion and immediately remove the intravenous catheter. Option B. Elevate the affected arm on a pillow to reduce swelling. Option C. Apply a warm compress directly over the active infusion site. Option D. Decrease the flow rate of the intravenous fluids to a keep open rate. The correct answer is option A. Stop the infusion and immediately remove the intravenous catheter. Swelling, redness, and pain indicate phlebitis or infiltration. The immediate priority is to stop the infusion and remove the catheter to prevent further tissue damage and complications. Question 123. The nurse notices fading bruises on a client arm. The client appears fearful and avoids eye contact. Because these are possible signs of physical abuse, What is the nurse's most appropriate action? Option A, report the findings to the appropriate authorities based on state protocol. Option B, ignore the bruises since the client is being treated for an unrelated illness. Option C, confront the client's spouse in the waiting room about the bruises. Option D, tell the client they cannot leave the hospital until they confess what happened. The correct answer is option A, report the findings to the appropriate authorities based on state protocol. Healthcare professionals are mandated reporters. Any suspicion of abuse must be immediately reported to the designated protective services agency or local authorities according to state law. Question 124. The nurse is caring for a client who sustained a high-voltage electrical burn. The nurse plans to take which priority action immediately upon arrival? Option A, obtain a 12-lead electrocardiogram. Option B, provide aggressive topical wound care. Option C, initiate supplemental oxygen via nasal cannula. Option D, administer prophylactic intravenous antibiotics. The correct answer is option A, obtain a 12-lead electrocardiogram. Electrical burns send powerful currents through the body, potentially causing fatal cardiac arrhythmias. Immediate continuous cardiac monitoring and an electrocardiogram are absolute priorities. Question 125. The nurse is caring for a pediatric client with a gastrostomy jejunostomy tube. The nurse knows that excessive drainage from this tube places the child at high risk for which electrolyte imbalance? Option A, hyponatremia. Option B, hypercalcemia. Option C, hypophosphatemia. Option D, hyperkalemia. The correct answer is option A, hyponatremia. Gastrointestinal fluids, especially below the stomach, are highly concentrated with sodium. Excessive loss of this fluid through a jejunostomy tube rapidly leads to severe hyponatremia. Question 126. The nurse is caring for a client receiving intermittent enteral feedings via a jejunostomy tube. Which intervention is the highest priority to reduce the risk of aspiration? Option A, place the client in a semi-Fowler position following feedings. Option B, flush the tubing with 20 milliliters of water after feeding. Option C, assess the client blood glucose every 6 hours. Option D, position the client flat on their left side during the feeding. The correct answer is option A, place the client in a semi-Fowler position following feedings. Elevating the head of the bed to a semi-Fowler position utilizes gravity to keep the formula in the intestines, significantly reducing the risk of gastric reflux and pulmonary aspiration. Question 127. The nurse is reviewing a new prescription for intravenous amphotericin B. The nurse understands that this potent medication is used exclusively to treat which condition? Option A, systemic fungal infections. Option B, severe bacterial sepsis. Option C, viral encephalitis. Option D, autoimmune exacerbations. The correct answer is option A, systemic fungal infections. Amphotericin B is a highly toxic, powerful antifungal medication used only for progressive, potentially fatal systemic fungal infections. It is not effective against bacteria or viruses. Question 128. The nurse observes a rhythm on the telemetry monitor showing a complete dissociation between P waves and QRS complexes, with a ventricular rate of 35 beats per minute. This rhythm is known as Option A, complete heart block. Option B, atrial fibrillation. Option C, ventricular tachycardia. Option D, first-degree atrioventricular block. The correct answer is option A, complete heart block. A third-degree or complete heart block is a fatal rhythm where electrical impulses from the atria fail to reach the ventricles, requiring immediate intervention such as a pacemaker. Question 129. What is the nurse's absolute priority action when a fire occurs in a client room? Option A, rescue the client in immediate danger. Option B, sound the hospital fire alarm. Option C, contain the fire by closing the door. Option D, extinguish the fire with a portable extinguisher. The correct answer is option A, rescue the client in immediate danger. According to the RACE acronym for fire safety, the very first step is always to rescue or remove any clients, visitors, or staff who are in immediate danger. Question 130. The nurse attends a seminar on disseminated intravascular coagulation. Which of the following clients is at the highest risk for developing this life-threatening condition? Option A. A client being treated for gram-negative bacterial sepsis. Option B. A client taking a daily low-dose aspirin for cardiac health. Option C. A client with a history of iron deficiency anemia. Option D. A client receiving prescribed rivaroxaban for atrial fibrillation. The correct answer is option A. A client being treated for gram-negative bacterial sepsis. Gram-negative sepsis releases potent endotoxins that aggressively trigger the systemic clotting cascade, rapidly consuming clotting factors and leading to disseminated intravascular coagulation. Question 131. During tracheal suctioning of a client, the licensed practical nurse notes the client heart rate jumps from 80 to 130 beats per minute. Which action should the nurse take immediately? Option A. Stop suctioning and check the client oxygen saturation. Option B. Hurry up and finish the suctioning pass quickly. Option C. Call a rapid response code immediately. Option D. Administer a prescribed dose of intravenous metoprolol. The correct answer is option A. Stop suctioning and check the client oxygen saturation. Tachycardia during suctioning is a cardinal sign of severe hypoxia. The nurse must immediately stop the procedure, reoxygenate the client, and assess their oxygen saturation. Question 132. The nurse cares for an elderly client reflecting on their life experiences. Which statements reflect the psychological concept of ego integrity? Select all that apply. Option A. The individual experiences a sense of fulfillment and satisfaction with life. Option B. The individual reflects positively on past accomplishments and life experiences. Option C. The individual feels profound regret and dissatisfaction with life choices. Option D. The individual constantly fears the approach of death. Option E. The individual blames others for their lack of career success. The correct answers are options A and B. The individual experiences a sense of fulfillment and satisfaction with life. The individual reflects positively on past accomplishments and life experiences. In Erikson's final stage of development, achieving ego integrity means looking back on life with a sense of fulfillment, acceptance, and positive reflection on past accomplishments. Question 133. When performing comprehensive skin assessments on clients, which clinical guidelines should the nurse follow? Select all that apply. Option A. Compare bilateral body parts for symmetry. Option B. Proceed in a systematic toe-to-head or head-to-toe manner. Option C. Use standard medical terminology to report and record findings. Option D. Perform the assessment only if the client complains of pain. Option E. Avoid touching the client's skin to prevent cross-contamination. The correct answers are options A and B and C. Compare bilateral body parts for symmetry. Proceed in a systematic toe-to-head or head-to-toe manner. Use standard medical terminology to report and record findings. A proper skin assessment is systematic, compares bilateral symmetry to identify localized abnormalities, and uses standardized terminology to ensure accurate communication among the healthcare team. Question 134. The nurse is conducting a health screening at a community clinic. Which factors should the nurse recognize as significant risk factors for developing type 2 diabetes mellitus? Select all that apply. Option A. A history of gestational diabetes. Option B. A diagnosis of metabolic syndrome. Option C. Chronic long-term corticosteroid use. Option D. A body mass index categorized as obese. Option E. A diet strictly limited to complex carbohydrates. The correct answers are options A and B and C and D. A history of gestational diabetes. A diagnosis of metabolic syndrome. Chronic long-term corticosteroid use. A body mass index categorized as obese. Gestational diabetes, metabolic syndrome, obesity, and the insulin resistance caused by chronic corticosteroid use are all major modifiable and non-modifiable risk factors for type 2 diabetes. Question 135. The nurse is assessing an infant who is exactly 9 months old. Which of the following gross motor milestones should the infant have achieved? Select all that apply. Option A, sitting upright without any physical support. Option B, rolling over from back to stomach completely. Option C, taking their first independent steps. Option D, building a tower of 6 blocks. Option E, scribbling with a crayon on paper. The correct answers are options A and B, sitting upright without any physical support, rolling over from back to stomach completely. By 9 months, an infant should easily roll over and sit without support. Walking and complex fine motor skills like stacking blocks or scribbling develop closer to 12 to 18 months. Question 136. The nurse is caring for a client with newly diagnosed essential hypertension. Which of the following lifestyle modifications are highly recommended for managing this condition? Select all that apply. Option A, weight loss targeting a normal body mass index. Option B, smoking cessation. Option C, decreasing daily dietary sodium intake. Option D, use of unverified herbal supplements to lower blood pressure. Option E, performing intense isometric weight lifting daily. The correct answers are options A and B and C, weight loss targeting a normal body mass index, smoking cessation, decreasing daily dietary sodium intake. Weight loss, smoking cessation, and strict sodium reduction are evidence-based lifestyle modifications that significantly lower blood pressure and reduce cardiovascular risk. Question 137. The nurse is reinforcing teaching with the parents of a child diagnosed with severe eczema. Which of the following instructions should the nurse include? Select all that apply. Option A, avoid using harsh soaps and laundry detergents. Option B, apply thick moisturizing lotion immediately after bathing. Option C, keep the child fingernails filed short and smooth. Option D, bathe the child exclusively in very hot water. Option E, wash the affected skin areas 4 to 5 times per day. The correct answers are options A and B and C, avoid using harsh soaps and laundry detergents. Apply thick moisturizing lotion immediately after bathing. Keep the child fingernails filed short and smooth. Eczema management requires avoiding irritants like harsh soaps, trapping moisture by applying lotion immediately after warm baths, and keeping nails short to prevent infection from scratching. Question 138. Which actions are recommended guidelines when providing routine foot care for diabetic residents in a long-term care facility? Select all that apply. Option A, bathe the feet thoroughly in a mild soap and tepid water solution. Option B, dry the feet thoroughly, especially the area between the toes. Option C, use an antifungal foot powder if necessary to prevent fungal infections. Option D, soak the feet in hot water and bath oil for 30 minutes daily. Option E, use sharp clippers to aggressively trim calluses and corns. The correct answers are options A and B and C. Bathe the feet thoroughly in a mild soap and tepid water solution. Dry the feet thoroughly, especially the area between the toes. Use an antifungal foot powder if necessary to prevent fungal infections. Diabetic foot care involves washing in tepid water, drying completely between toes to prevent maceration, and using antifungal powder. Soaking feet and using sharp objects are strictly prohibited. Question 139. The nurse is caring for a client who sustained an ischemic stroke impacting the occipital lobe. Which of the following neurological deficits would support this diagnosis? Option A, homonymous hemianopia. Option B, expressive aphasia. Option C, impulsivity and poor judgment. Option D, severe ataxia and loss of balance. The correct answer is option A, homonymous hemianopia. The occipital lobe is the visual processing center of the brain. A stroke here typically results in visual field deficits such as homonymous hemianopia, where the client loses half of their visual field. Question 140. The nurse prepares to administer an intermittent bolus tube feeding. The nurse aspirates 85 milliliters of residual from the nasogastric tube. Which actions are appropriate? select all that apply. Option A, document the color, odor, consistency and amount of the residual. Option B, administer the aspirated residual back into the client's stomach. Option C, hold the next feeding and notify the provider immediately. Option D, discard the residual down the sink to prevent bacterial overgrowth. Option E, send the residual fluid to the laboratory for a culture. The correct answers are options A and B. Document the color, odor, consistency and amount of the residual. Administer the aspirated residual back into the client's stomach. 85 milliliters is a normal residual volume. The nurse should document the findings and return the fluid to the stomach to prevent severe electrolyte imbalances. Question 141. The nurse is caring for a newborn immediately after a vaginal delivery. To prevent cold stress, which of the following actions is the most appropriate priority? Option A, quickly dry the newborn and place them skin to skin with the mother. Option B, perform the full APGAR assessment before wrapping the baby. Option C, suction the nose deeply before suctioning the mouth. Option D, administer the intramuscular vitamin K injection immediately. The correct answer is option A, quickly dry the newborn and place them skin to skin with the mother. Evaporation causes rapid heat loss in newborns. The priority to prevent cold stress is to dry the infant thoroughly and place them directly on the mother chest for skin-to-skin thermoregulation. Question 142. The nurse provides discharge education to a client with active tuberculosis taking isoniazid. Which statements indicate an understanding of the teaching? Select all that apply. Option A. Everyone in my family needs to go and see the doctor for tuberculosis testing. Option B. I will cover my mouth and nose when I sneeze or cough and put used tissues in a plastic bag. Option C. I will change my diet to include more foods rich in iron, protein and vitamin C. Option D. I will stop taking the isoniazid as soon as my cough goes away. Option E. I can safely share utensils with my family once I start the medication. The correct answers are options A and B and C. Everyone in my family needs to go and see the doctor for tuberculosis testing. I will cover my mouth and nose when I sneeze or cough and put used tissues in a plastic bag. I will change my diet to include more foods rich in iron, protein and vitamin C. Family members require testing due to exposure. Proper tissue disposal prevents airborne spread, and a nutritious diet aids immune recovery. Medications must be completed entirely. Question 143. Which of the following describes the most appropriate outcome for a 75-year-old client with Huntington disease who has developed severe muscle contractures? Option A. The client will participate in range of motion exercises to reduce the progression of contractures. Option B. The client will verbalize the effects of contractures on activities of daily living. Option C. The client will monitor for signs of skin breakdown resulting from the contractures. Option D. The client will learn to reposition himself in bed entirely without assistance. The correct answer is option A. The client will participate in range of motion exercises to reduce the progression of contractures. Huntington disease is a progressive neurological disorder. Active or passive range of motion exercises are critical to maintain joint flexibility and prevent the worsening of debilitating contractures. Question 144. Which action is the most appropriate alternative to physical restraints for an elderly client who is disoriented and frequently wanders the halls of a long-term care facility? Option A. Put a large picture of the client and a balloon on his door so he recognizes his room. Option B. Keep the client bed in the highest position so he is afraid to get out. Option C. Use tightly tucked bed sheets to secure the client snugly in the bed at night. Option D. Sit the client in a restrictive geriatric chair facing the nurse station all day. The correct answer is option A. Put a large picture of the client and a balloon on his door so he recognizes his room. Wandering is a common behavior in dementia. Using personalized visual cues, like a familiar picture on the door, helps orient the client to their room without using restrictive or unsafe measures. Question 145. The nurse reinforces teaching to a client prescribed tamsulosin for benign prostatic hyperplasia. Which of the following statements should the nurse include? Option A, change position slowly from lying to sitting while you take this medication. Option B, this medication will turn your urine a harmless reddish-orange color. Option C, you will urinate much more frequently during the night with this medication. Option D, avoid calcium-containing foods like milk and cheese while on this medication. The correct answer is option A, change position slowly from lying to sitting while you take this medication. Tamsulosin is an alpha blocker that relaxes smooth muscle but also causes systemic vasodilation. The most significant side effect is severe orthostatic hypotension, requiring slow position changes. Question 146. During a routine preoperative assessment, the nurse detects an elevated temperature in a client who is otherwise asymptomatic. What should be the very first nursing action? Option A, validate the finding by checking the temperature again with a different thermometer. Option B, document the finding in the electronic health record immediately. Option C, inform the charge nurse that the surgery must be cancelled. Option D, administer a prescribed dose of oral acetaminophen. The correct answer is option A, validate the finding by checking the temperature again with a different thermometer. If a vital sign is abnormal and does not match the client clinical picture, the nurse must first validate the finding to rule out equipment malfunction or user error before taking clinical action. Question 147. The licensed practical nurse collects data on a client who has intentionally overdosed on aspirin. Which clinical finding indicates a severe, life-threatening complication? Option A, pulmonary edema. Option B, tachycardia. Option C, nausea and vomiting. Option D, tinnitus. The correct answer is option A, pulmonary edema. While tinnitus and tachycardia are expected, a massive aspirin overdose can cause increased alveolar capillary permeability, leading to noncardiogenic pulmonary edema and severe respiratory failure. Question 148. The nurse evaluates a student's ability to remove personal protective equipment. To prevent contamination, in what order should the student remove the equipment? Option A, gloves first, followed by goggles, and then the gown. Option B, gown first, followed by gloves, and then the goggles. Option C, goggles first, followed by the gown, and then the gloves. Option D, gloves first, followed by the gown, and then the goggles. The correct answer is option A, gloves first, followed by goggles, and then the gown. The most contaminated item is the gloves. Gloves should be removed first, followed by eyewear or goggles, and finally the gown, rolling it carefully away from the body. Question 149. Which of the following clients would be the most appropriate to assign to a licensed practical nurse? Select all that apply. Option A, a stable client receiving intravenous antibiotics for lower extremity cellulitis. Option B, a patient needing scheduled continuous tube feedings and routine colostomy irrigations. Option C, a client newly admitted with an acute exacerbation of myasthenia gravis. Option D, a client with a chest tube receiving mechanical ventilation for respiratory failure. Option E, an unstable diabetic client experiencing severe ketoacidosis. The correct answers are options A and B, a stable client receiving intravenous antibiotics for lower extremity cellulitis, a patient needing scheduled continuous tube feedings and routine colostomy irrigations. The licensed practical nurse should care for stable clients with predictable outcomes. Administering routine antibiotics and managing established tube feedings are well within their scope of practice. Question 150. A client recently had a fiberglass cast applied to their right leg. Which of the following statements by the client indicates a medical emergency requiring immediate intervention? Option A, I have been having severe throbbing pain in my right calf that pain pills do not help. Option B, my right leg feels really itchy under the cast material. Option C, I did not keep my leg elevated on pillows like the doctor asked me to. Option D, when I put weight on my crutches my wrists get sore. The correct answer is option A, I have been having severe throbbing pain in my right calf that pain pills do not help. Unrelieved, severe pain in a cast extremity is the hallmark sign of compartment syndrome, a surgical emergency caused by swelling inside the rigid cast that cuts off blood supply. Question 151. When discussing the Denver Developmental Screening Test with a parent, which statement indicates that they correctly understand the purpose of this assessment? Option A. This test will measure my child developmental milestones. Option B. This test will tell me whether or not my child intelligence quotient is normal. Option C. This test will predict my child academic success in elementary school. Option D. This test will diagnose my child with an autism spectrum disorder. The correct answer is option A. This test will measure my child developmental milestones. The Denver test is purely a screening tool used to observe and measure gross motor, fine motor, language, and social developmental milestones in infants and preschool children. Question 152. When looking for baseline trends in a postoperative client vital signs over the past 3 days, which part of the medical record would the nurse review first? Option A. The graphic record. Option B. The admission history and physical sheet. Option C. The daily activity flow sheet. Option D. The physician progress notes. The correct answer is option A. The graphic record. The graphic record visually plots vital signs over time, allowing the healthcare team to quickly identify trends, improvements, or signs of clinical deterioration. Question 153. The nurse cares for a group of assigned clients. Which client would be the most appropriate to refer for an interdisciplinary care conference? Option A. A client with an ischemic stroke who has dense left-sided hemiplegia. Option B. A client with pulmonary tuberculosis receiving multiple daily prescriptions. Option C. A client with hyperthyroidism who is scheduled for a routine thyroidectomy. Option D. A young adult with a fractured tibia who is being discharged to their parents' house. The correct answer is option A. A client with an ischemic stroke who has dense left-sided hemiplegia. A client with severe hemiplegia from a stroke has complex rehabilitation needs requiring coordination between nursing, physical therapy, occupational therapy, and social services. Question 154. A client sustained a fractured tibia and has a cast applied. Which of the following findings would strongly indicate the client has developed compartment syndrome? Option A. Severe pain that is completely unrelieved by an opioid analgesic. Option B. The sudden development of petechiae over the chest and neck. Option C. A new onset of severe dyspnea and sharp chest pain. Option D. Localized bone pain accompanied by a high fever. The correct answer is option A. Severe pain that is completely unrelieved by an opioid analgesic. Pain out of proportion to the injury that is not relieved by strong narcotics is the earliest and most reliable indicator of compartment syndrome and impending tissue ischemia. Question 155. A nurse is caring for a client with a history of generalized seizures. Which intervention is the absolute highest priority to reduce the client risk of physical injury? Option A. Implement seizure precautions including padded side rails up and the bed in the lowest position. Option B. Keep the client room completely dark to minimize visual stimulation. Option C. Provide extensive education to the family about seizure triggers. Option D. Administer all scheduled anti-epileptic medications with milk. The correct answer is option A. Implement seizure precautions including padded side rails up and the bed in the lowest position. Physical safety is paramount. Keeping the bed low to the ground with padded side rails prevents traumatic brain injury and fractures if a violent tonic-clonic seizure occurs. Question 156. The nurse understands that a severe lack of antidiuretic hormone, resulting in diabetes insipidus, is a frequent and dangerous complication of which surgical procedure? Option A. Surgical removal of the pituitary gland. Option B. Total abdominal hysterectomy. Option C. Dilation and curettage of the uterus. Option D. Total knee arthroplasty. The correct answer is option A. Surgical removal of the pituitary gland. The posterior pituitary gland stores and secretes antidiuretic hormone. Surgical removal or trauma to this gland stops hormone release, leading to the massive polyuria seen in diabetes insipidus. Question 157. Which of the following infection control activities is appropriate for the nurse to delegate to an experienced unlicensed assistive personnel? Option A. Disinfecting electronic blood pressure cuffs and thermometers after client discharge. Option B. Asking newly admitted clients about the duration of their antibiotic therapy. Option C. Demonstrating correct sterile handwashing techniques to visiting family members. Option D. Screening waiting room clients for upper respiratory tract symptoms. The correct answer is option A. Disinfecting electronic blood pressure cuffs and thermometers after client discharge. Cleaning and disinfecting non-critical, reusable medical equipment according to agency protocol is a standard, safe task that is routinely delegated to unlicensed assistive personnel. Question 158. A client presents to the emergency department with a core body temperature of 106 degrees Fahrenheit and anhidrosis. The nurse anticipates a rapid infusion of option A 0.9% normal saline, option B liquid acetaminophen via a nasogastric tube, option C intravenous ketorolac, option D hypertonic 3% saline. The correct answer is option A, 0.9% normal saline. This client is experiencing heat stroke, a medical emergency characterized by profound dehydration and vascular collapse. Rapid fluid resuscitation with isotonic normal saline is critical. Question 159. The nurse is triaging phone calls at an oncology clinic. The nurse should immediately follow up with the breast cancer client who reports option A. Severe swelling and pain in their right leg while taking tamoxifen. Option B. A decreased libido while receiving prescribed dutasteride therapy. Option C. Hot flashes and night sweats while receiving prescribed letrozole. Option D. Mild bone pain 24 hours after receiving prescribed filgrastim. The correct answer is option A. Severe swelling and pain in their right leg while taking tamoxifen. Tamoxifen is an estrogen antagonist that significantly increases the risk of deep vein thrombosis. Sudden, painful leg swelling is a medical emergency requiring immediate ultrasound evaluation. Question 160. When an elderly home health client suddenly develops severe confusion and delirium, what is the very first potential cause the home health nurse should assess for? Option A. Prescription or over-the-counter drug intoxication. Option B. Undiagnosed metastatic brain cancer. Option C. End-stage congestive heart failure. Option D. Early onset Alzheimer's disease. The correct answer is option A. Prescription or over-the-counter drug intoxication. Delirium is an acute, reversible state of confusion. In the elderly, decreased renal clearance makes them highly susceptible to toxicity from routine prescription and over-the-counter medications.